Happy Tuesday, everyone. Welcome to Ask Dr. Jeff, the interactive Zoom platform where we discuss all things photobiomodulation and Lifewave technology. My name is Dr. Jeffrey Hubbard. I'm a medical doctor here in the Fort Worth Metroplex, the Dallas Fort Worth Metroplex. And it is my pleasure to be your host and facilitator for our weekly discussion on the amazing technology that's revolutionizing how we approach our health and wellness and preventative care with scientific breakthrough technology known as photobiomodulation. Guys, that simply means that we utilize light to help the body to improve the way that it functions. Let me explain. Grab my trusty prop here. Here is a Lifewave photobiomodulation patch. Right there in the center of that patch, you can see there is a fiber mesh. That fiber mesh is covered with a liquid nanocrystal, a proprietary blend of organic materials, and it's designed to reflect certain frequencies of near infrared light. So guys, for those of you who are not aware, there are things on the light spectrum, frequencies of light on the spectrum that we cannot physically see with the human eye. That does not mean it's not there. And one of them is near infrared light, both near and far. The interesting part about it is our body is actually producing infrared light right now in the form of body heat. And that's what is activated through the utilization of the patch. That light frequency through our body heat is reflected back into our skin, and it induces our body to produce certain molecules. In the instance of the patch that I showed you, the X39, that particular molecule is called GHK copper peptide. This is not unique to Lifewave. This particular molecule has been studied since the early 1970s, primarily by a doctor from Harvard by the name of Lauren Picard. So Professor Picard has been coined the turn back the clock doc because of all of his really powerful and dynamic research on how this particular molecule engages the human body. Its most profound effect is through gene expression. So it helps to increase certain gene expressions and to decrease certain gene expressions, which ultimately leads to a healthier and more vibrant you. Particularly, it helps with our cognitive functioning, with making us feel younger and more youthful in our ability to use our minds. It helps with our cardiovascular system. It helps with our endocrine system. It helps to alleviate pain and discomfort in our musculoskeletal system. It has a whole host of really powerful results when you consistently increase the amount of this particular product. And that's what the X39 has been clinically proven to do. Quite the exciting bit of information. I know it's a lot to take in if this is your first time hearing about the technology and or GHK copper peptide, but I can say both personally and professionally, I have seen the power of this particular phenomenon, and it's simply amazing. There are people all around the globe that are experiencing this technology and are really gaining significant benefits from its utilization. All right. So here on Ask Dr. Jeff, we are students of this amazing science, and we're always in a learning mode and trying to gain an appreciation for how we can leverage this technology to be at our optimal state of health and wellness. All right. So I was just thinking earlier today, what am I going to discuss today? And typically the scenario goes, we do a brief introduction, which we've covered, and then we talk about an article, or we talk about acupuncture locations, which is where you apply the patches, or we talk about some particular protocol, how to use the patches in combination, how they work together, where to apply them, But, you know, we talk so much about that, but we haven't really covered the basics. What are the basics? What is the anatomy, right? What is going on in the different parts of our body? Why are those areas commonly slowing down or declining and needing the help of the patch? So we're going to go on a series, guys, of examining the human anatomy and kind of understanding exactly what's happening in those respective locations and how we can better understand what's going on and how we can begin to approach those issues. All right. So today we're going to start off simplistically with the knee. So we'll talk about the anatomy of the knee. And next week, I'll figure out another part of the body to begin to examine and help you to understand exactly what's going on with these problem areas, right? So we're just going to use my knee as example, okay? So starting off, right, the thigh bone, or also known as the femur, is going to come in and represent the top portion of the knee, all right? So this is the hinge joint of the knee, the top of the hinge joint, all right? Slide right there, all right? The kneecap, right? This is called the patella, all right? So this is actually connected to the quadriceps tendon up here that connects to the top of the knee, and to the patella tendon down here, which basically connects to the shin bone or the tibia, all right? So the lower part of the leg contains two bones. One is out on the outside of the leg, that's called the fibula, and the actual shin bone itself is called the tibia. All right, so they come together and attach themselves to the femur. All right, the patella is on the front of the knee, which protects the internal capsule or the bursa area of the knee. All right, so the bursa is very important because it houses all of the soft tissue that keeps the knee structural integrity, all right? So we've got four major ligaments that we want to cover today. Ligaments connect bone to bone, keep that in mind. Tendons connect muscle to bone. So we're going to talk about, this is the medial side of the knee. So this is the medial collateral ligament, which basically connects the medial portion of the femur to the medial portion of the tibia, all right? So that ligament is about that long, and it's responsible for keeping the knee from moving side to side. All right, same thing on the outside. This is called the lateral collateral ligament, all right? So again, it keeps the knee structurally from moving from side to side, all right? So that's this one, about that long in duration. All right, we talked about this one, which is the patella tendon that keeps the kneecap in place. And then on top here is the other portion of the patella ligament, which connects to the quadricep or the muscles in the thigh, all right? On the inside of the knee, so imagine if you move this patella out of the way. On the inside, there's an anterior cruciate ligament, which keeps, stretched out like this, which keeps these, the thigh and the shin from moving apart from each other, all right? And then behind that is the posterior cruciate ligament, which keeps the thigh from moving up and the shin moving back, all right? So all of those are structurally sound. So you often hear, for those of you who are into sports, you often hear about athletes damaging their ACL, which is the anterior cruciate ligament, and having to have surgery to have that repaired. That is a very long, drawn out process because it's really difficult to run, plant, or shift directions without that structural integrity inside the knee, okay? So oftentimes, the real problem is that the shock absorber, which is called the meniscus sits in between this femur and the tibial head, okay? So it's just a shock absorber. So as you walk and run and do whatever you're gonna do, this absorbs the weight that you put on the lower leg. So that meniscus can get torn up, it can get folded. So many different types of injuries can happen to that meniscus depending upon traumatic injury or wear and tear. But most commonly, they just become very thin because of age. So if you've ever seen an x-ray of a knee, if you've ever seen an MRI of the knee, and you see it looks like bone on bone, that's because the meniscus has deteriorated and gone away, all right? So that typically is what is most common through a pain or a discomfort in the knee in our older years, in our senior years, is that there's no shock absorption and there's no way for the knee to support the weight that you're putting on it on a day-to-day basis. So that's why we apply patches here in the eyes of the knee, because that is traditionally where your meniscus is going to be located and a lot of the pressure and discomfort is going to be located. So as you notice, these are spongy areas, right? Not the same as bone here, here, and here. These spongy areas are great ways that the light therapy can find its way to the internal capsule of the knee to help with those ligaments, the ACL and the PCL, as well as the meniscus, and to help a lot of the inflammation and things that are happening inside the knee. So that is a very basic explanation of the anatomy of the knee and why we patch here at the eyes of the knee, and oftentimes also on the top, the kneecap, just above the kneecap, because those are the problem areas that typically occur in the knee joint. And so again, this phenomenon in acupuncture where we triangulate the patches, you know, either the triangle is pointing up or the triangle is pointing down, those are going to be very effective for helping to deal with inflammation of the knee, any infection the knee may have, or just any wear and tear if you're looking to rebuild cartilage and tendons and ligament tissue in the knee. Those are great places to patch, okay? So quick rundown of the knee. I'll tell you this, we're gonna do the shoulder next week because the shoulder is another very delicate sort of joint that is commonly injured. A lot of people have told me that they have rotator cuff issues or challenges with nerve impingement or any sort of issue in the shoulder. So we'll talk more about that and how to patch for the shoulder, all right? So Louise is asking a question. Louise, before we get to that, let's just go ahead and do our housekeeping. Guys, as we transition into the question and answer period, our emphasis is on symptomology, right? We use Lifewave language here because our patches have not been approved by the Food and Drug Administration here in the US. We have to mention and protect the integrity of the company. They are not designed to heal, treat, cure, or prevent any medical condition or any medical illness. So we just want to make sure that we explicitly state that, and that even though we're discussing, you know, symptomatic issues, et cetera, this is not designated as medical advice. Dr. Jeff is not giving you medical advice. He is making suggestions about how to properly utilize the patches to address any symptoms that you may have, okay? So in the chat, Louise has asked what specific patches are good for the knee, all right? And so in this instance, Louise, it really kind of depends upon what's happening with the knee, okay? So if you have a traumatic injury to the knee, that creates a lot of inflammation, and that is basically and best addressed with Eon and glutathione. So those would be probably your best two choices, subsequently by X39. So X39 is a long-term solution. Eon glutathione is great for anti-inflammation, all right? If you have an infection of the knee or an infection in the joint, which is not common, but it does happen, that also is going to be the anti-inflammatory protocol. I mean, you want to use glutathione. That's going to be very helpful for modulating your immune response. Eon is going to be helpful with the inflammatory response and also moderating the pain and discomfort. You could also use Lifewave for both of those scenarios because that's going to be great for pain reduction as well. And then long term, you want to consider the X39 because the X39 is what's going to help rebuild and repair the tissue in the knee. Now, if you're dealing with something where you're having bone on bone and you're rubbing, and so we're right on the same task. So bone on bone and you're rubbing, or you've got an autoimmune issue in the joint, that's going to be best moderated in a similar way, but I would say you have to stepwise it. So if the pain is the major issue, walking around is difficult. Lifewave.
Dr. Jeff, you froze.
You froze an ice wave.
He did, truly.
All right, Bill.
All right, I'm back. Can you guys hear me okay?
Yes.
Okay, thanks very much. Okay, so as I was saying, Luis was asking a question about bone on bone pain, and I was just getting ready to explain that. I think that's where I got cut off. So in a bone on bone issue, if the pain is the major concern, Lifewave is obviously going to be the best choice. Lifewave should be placed in the eyes of the knee, tan on the left, white on the right, and then above the patella tendon, above the patella itself, the kneecap, you should use glutathione and Eon stacked. That will help with the inflammatory process and inflammation going on that's likely causing the pain. Once you get the pain and discomfort under control and you're able to walk and utilize the knee, then you shift over to X39 or you wear X39 at night, because that is really the key that's going to help rebuild the soft tissue. So that's the real emphasis there, is on what the symptoms are, because the patches really are great for the symptoms more so than they are for what's actually causing the root cause of the issue, right? That's a long-term strategy in the bone-on-bone scenario, because you have to rebuild the cartilage and the menisca, as we talked about during the discussion of anatomy, okay? All right, so now we're officially in the question and answer period. We didn't talk about raising your hand, so we got a reaction icon right at the bottom right hand, not quite far right hand, but towards the right side of your screen. It's a smiley face with a plus sign. You want to click that. That allows you to raise your hand. It allows you to give a thumbs up, to send various different emojis, etc. Utilize that, and we can get some chronological order based upon who wants to ask a question and how we roll forward, all right? So I just want to make sure, Luis, did that answer all of your questions thus far?
Yes, thank you, Dr. Jeff. Thank you very much.
Appreciate it, my friend. Thanks for the question. Okay. All right, Dave, your turn, sir. Go right ahead and unmute yourself and ask your question.
Hey, good evening, Dr. Jeff. Again, thanks for all that you do. Such a blessing for the community. A question, well, two questions. One, what would you recommend for a customer who was having the symptoms when you sit up or you turn your head too fast or something and you start to get that dizzy, feeling, and it feels like the room is spinning? We had put Eon before on them for like behind the ear, and it was helping great for a while, and then it seemed like it wasn't helping as much anymore, so that we did energy enhancer on both sides, but same spot behind the ears, and then did the Eon on top of the head to try to do the triangle. And then after that, seemed like it did good for a while. And now it seemed like they're saying it's not helping as much anymore. So I don't know if they were getting used to it or something, or is there something else we can try, different formation or different areas, or maybe a different patch?
Sure. I've had the most success with X39 actually on that. And so if it's equal on both sides, you put an X39 behind each ear on that bony process. That's called the mastoid process behind the ear. So I would try that. It seems like, perhaps there needs to be a little examination to find out what the root cause is.
Yeah.
So if you want to shoot me an email and kind of give me some more details about how it started and kind of what more of the picture looks like, then perhaps we can have a better approach. But typically, X39 on either side is really dynamite, or in addition to the Eon, you add glutathione. So you stack those two and you put them behind one ear or the other, depending upon which side is worse, or if both sides are bad, you can apply the patches to both sides.
Got it. Okay, thanks a lot, Dr. Jeff. Appreciate it.
Absolutely, sir. Hopefully that's helpful.
Yes, sir.
All right, Bill, how are you, sir? Go right ahead and ask your
Very
question.
good. Two quick ones. You said X39 at night. So when you're doing that, don't use the X39 during the day.
That's correct. You would have to make a choice.
I'm
So
learning.
if you are wearing X39 during the day and that's your cup of tea and you enjoy it, then you let the other patches do the work, and then maybe on occasion you double patch. So if you wear X39 on the back of the neck during the day, then you can also wear it on the knee during the day. You can wear as many X39s or as many patches as you like. It's just about making sure that you give your body ample amount of rest. All right. So, I have really been doing a lot of experimentation with wearing X39 and X49 at night, because that's when your body is in the anabolic state. It's rebuilding, it's repairing, it's regenerating. So I'm inclined to say that X39 and X49 are more helpful overnight when you're sleeping. But there's a couple of different schools of thought about that. But that's kind of my opinion based upon the last year or so, 10 months, 12 months that I've been experimenting with, exclusively wearing X39 at night. I just tend to think that it adds to the regenerative repairing process when we sleep. Thank
you. Number two, ringing in the ears.
So that was literally what David was just asking about, just a different sort of phenomenon. It would be wearing the patch right behind the ear, right on that bony process, and just sort of examining which side is worse. If there's more ringing on the left or more ringing on the right, that's where you would patch. If it's equal ringing on both sides, you would patch both sides. So you can try the X39 or you can try the glutathione and Eon.
Thank you.
Yes, sir. All right, Charlotte, go right ahead and ask your question. Charlotte, are you there?
I am sorry.
No worries.
I have a customer who has a horse, and I know you're not a veterinarian, but the symptoms are the same in some people. Her horse does not sweat. And so I know that that's a symptom of something. Anyway, we did try Lifewave because she thought maybe it was an inflammation problem, but her horse kept kind of rolling things off. And she hasn't really seen a change in the animal. Is there a patch or two that you would recommend that might actually promote sweating?
Oh, that's tough. So two things that typically control perspiration, right? One is the thermoregulatory system that happens in the brain. So first of all, your body would need to know that you're overheating and you need to perspire to try to cool down. So I would just patch, the equivalent of the third eye on the horse, somewhere on the front of its face, in the general region where the brain is located, and see if that is helpful. Something like X39, maybe something like Alavita. I have literally no experience with AccuLife, so I'm not quite sure exactly how it works, all the details. I understand that it's very similar to the other patches. It is just marketed as a pet patch. So, you can try that as well. But I would go towards the thermoregulatory system, which is housed inside the cranium, and hope that the hormones and everything necessary to produce perspiration is impacted. All right. Number two, central nervous system. There could be some issues with, the communication between the nerves. If the equestrian is still, doing everything normal, seems to be normal, just not sweating, that it probably more is a hormonal thing than a nervous system thing. So I would experiment with a couple of different patches, X39, AccuLife, Alavita. All of those are going to have really great functionality on improving cognitive function and brain stuff. X49 might be helpful. I mean, it's new. We're still learning so many different things about how it works. That could be helpful as well. What I would do, obviously horses are larger than humans, so it might not be the same thing, but in order to be more cost effective, you could take patches that she's already worn and experiment with them on her horse.
Thank you.
Welcome. Hope that helps. Let me know, shoot me an email or come back next Tuesday, because I'd like to learn more and more about how the horses respond to the patches. There's actually a gentleman on YouTube who is very proficient with livestock, and that's how he's been able to be successful in Lifewave, by helping individuals who have large animals patch appropriately, right? And probably Lifewave and horses or Lifewave and pets would be the way that you would search for him on YouTube. I can't quite recall his name at the moment, but I think he's somewhere Utah or Wyoming, something like that. Okay, I hope that helps. All right, Chris, go right ahead. Ask your question. Sorry, I'm muted and ask your question.
That's okay. Dr. Jeff, I actually don't have a question. I just wanted to give you a thank you and an update on a customer that you had helped me with, who has a condition where they lose the vision in the center of their eye to out and can lead to blindness. And we followed your protocol. I actually emailed you about this, and that she had cut back from the X39 and the Eon and just gone to glutathione, and I got her back on the full thing. She went to her eye doctor about 2.5 weeks ago, and I have been working with this woman for years, so I know her history very well, and I was able to slow down this process, but I wasn't able to stop it until the patches and this protocol. And she went to her doctor, and he said she is stabilized.
Whoa.
Yeah.
Whoa, that's a big word. I mean,
That's a big word.
I love that because, you know, to me, anything that's not continuing to decline, when that's what the nature of the illness does, is just declines and keeps declining. So that's great. I mean, that's really wonderful. I mean, you know, hopefully now that it's stabilized, maybe she can regain some of the functionality, you know, and go the opposite direction. That would be really good. So,
well, then she called me. She called me a few days later. She called me to tell me what her doctor said, and we were celebrating because truly I've been working with this lady for years. And then she called me a few days later to tell me that she was able to change the filter in her hearing aid. She's in mid-80s, and she was able to change the filter in her hearing aid for the first time in years because she could see where to put the pin. So it is already, she's already regaining. And before she couldn't see, it was just a blank slate to her. So we've already had some progress backwards. So I'm super excited, and thank you so much for your mentoring.
that's awesome. It's like praise dance, you know.
I know, it really is.
That's great. That's great. Well, thanks for the report, and I greatly appreciate that. It's always good to get positive feedback about the strategies and all of that good stuff. So great to hear, and tell her to keep at it. And, you know, hopefully the progress makes her, you know, more excited and more consistent and all of that good stuff. Because
It is definitely making her stay with the program. So I'm really excited.
awesome. Well, you keep up the hard work. I know you're working diligently to get everybody locked in. So thanks so much for that.
You bet. Thank you.
All right, Mr. King, go right ahead, sir. Unmute yourself and ask your question.
Hello, everybody. I've got a client, I got a friend who I introduced to the patches probably about a year and a half, almost two, about the same time I did. But they've come back to me since, and her symptoms are, she says it feels like her, see, what's that on top of your leg? Quad, right?
Mm-hmm.
Okay, so she says she has a heaviness in her quad. And of course, the patching protocol calls it a weakness in the legs. And so are the two intermingled?
That's fair. I mean, you know, it's kind of subjective what a heaviness means. You know, that a heaviness to me could be different to you, could be different to her. But I think that's fair. You know, the question is, what is the background? When did this heaviness start? What is it like? You know, is it difficult to use the muscle? Is it painful? You know, those sorts of things. Because if we can address those issues, then really the rationale for how it started doesn't matter as much if we can begin to improve it and make it feel better. So that's really the power of the patches, is they kind of have their own intelligence when they're working with certain things. And even if we don't understand what the root cause is, if it starts to improve the symptoms, I think everybody's happy. So you know, one strategy could be patching right on the heaviness or right on the muscle. You know, the quadricep, the reason it's called a quad is because there's actually 4 different muscles that are extending the leg, right? That's the whole nature of that. And then the hamstring on the back of the leg is about, you know, flexing the leg. So you could just patch right on top of the thigh, you know, glutathione, Eon, X39, around in there. I know I keep saying all the same ones, but those are really the 3 key patches when you have some decline in the functionality of a joint, or the functionality of a muscle tissue, or functionality of some soft tissue, a ligament, a tendon, etc. Those are the 3 patches that are going to be really helpful in, you know, kind of improving the functionality of the area. Now, it could be heaviness, could be that, you know, she's not getting appropriate innervation of the muscle. So the nerve that is responsible for making that muscle work is maybe not responding as well. Perhaps it's pinched in another area, that because it's very common. And so, you know, there is specific nerves, obviously, that make that quadricep work. and they do come from the spinal column. So if she's had any sort of injury to the back or any sort of injury to, the area where that nerve traverses to get to the quadricep, that could also be a part of the problem as well. So in that instance, putting X39 on the back, putting X49 on the back could be a solution for the heaviness.
Okay, I got you.
It's unfortunately, these are one of those things where it's a little bit of trial and error, a little bit of things that you kind of got to put it on and see how it happens. And if you take 2 or so weeks and you're not really seeing much benefit, then you might need to add some stuff or switch it up or pump it up, whatever the case may be. So you might need a couple of patches, you might need to change, you might need to add. So let's just kind of talk about it until we can figure out exactly what the solution is.
Will do.
All right, sir. I appreciate the question. That was a good one. All right, Stephanie, your turn. Go ahead and unmute yourself and ask your question. How are you?
I'm good. How are you?
I'm doing.
You said that you were experimenting with the 39 and 49 at night. Are you stacking them or?
Yes.
And then when and where would you suggest doing the Alavita just for general usage?
Where would I wear it or what time?
Yeah, day or night, and then where would you put it?
I wear it right here on my third eye. So I've mentioned this before, but I'll mention it again. Here's my sort of daily protocol. During the day, most oftentimes, glutathione during the day, Nirvana during the day, energy enhancer during the day, and carnosine during the day. So I wear those 4 during the day, and then I wear X39, X49 at night, and I wear Eon and Alavita at night. So I wear Eon Alavita here stacked, and I wear X39, X49 on the back of the neck or below the navel. I kind of alternate depending upon how I feel. So I try to listen to my body when I put my patches on. And glutathione, I'm always focused on my liver and detoxifying my liver and making sure my liver is strong. So I put that on my top of my right foot on the liver meridian. I wear energy enhancer on the bottom of my feet. I wear Nirvana either back here behind my left ear or at the bottom of my neck. And then I wear carnosine in the center of my chest.
All right, thank you.
You're welcome. Hope you're feeling better, by the way.
Yeah, I actually, I'll email you.
Okay, will do. Sounds good. Plan. All right, ladies and gents, I have about 11 minutes after 8 my time. I don't see any more hands up. If there are any more questions, please raise your hand or unmute yourself and ask your question.
Dr. Jeff, did you say that you use where did you say you put the Nirvana and the glutathione during the day?
Is on the top of my right foot. That's liver 3 acupoint position. And the Nirvana, I alternate. Sometimes I wear it behind my left ear on the mastoid process. Sometimes I wear it right here at the bottom of the neck.
Thank you.
Welcome. All right, guys. Any more questions before we move to the closing remarks? All right, cool. Thanks so much. As always, it is such an honor and a pleasure to share space. As always, I am greatly appreciative of the support and all of the amazing conversations that we have. Chris gave a great testimonial today that the patches, guys, they simply work. All you got to do is wear them and be consistent and put them where they're supposed to be. And they are really dynamic. I mean, I don't know how many of you guys attended the convention this weekend, whether in person or virtually, but there's some amazing science taking place here. and we've got some really awesome leadership, and they've done the heavy lifting. They've spent the bucks. They've done the clinical trials. They've gone through the patent process. The technology is really profound. As you all know, last month I was in the Philippines. People were unbelievably impressed with the lectures and the demonstrations and the opportunity to test drive the patches and to see how they work and all of that good stuff, both those in the healthcare field and those who are part of the general public. Everybody was impressed. And so I'm just really starting to gain even more appreciation. I know that's kind of interesting to say, because for the last almost 3 years, I've been heavily involved in the promotion and global distribution of Lifewave products and the therapies that are associated with the protocols. But I just think this is a really powerful time to be involved with the company and to be aware of this technology. I just don't think we oftentimes appreciate how we're lucky, because many people have never, ever heard about Lifewave. And in certain instances, we'll never hear about Lifewave. And so they're not getting the opportunity to really take advantage of this really dynamic product, right? So I had a few epiphanies. I'm going to send out an email about some new services that I'd like to offer, and some cool things that I have been thinking about and finally decided to pull the trigger on for my exclusive Ask Dr. Jeff Lifewave family, okay? So I'm gonna offer those services to you guys first. If you have not added yourself to my database, please do so. Email me. You can do so at contactdrjeff@gmail.com. Or if you have any other email for me, that's specifically the one for adding yourself to the database. So we've got a pretty decent amount of people who've already done so. If you know you're not on the list, please do so. I'm going to be sending out that video welcoming you to certain services for Ask Dr. Jeff that have not been available before. So excited about that. Guys, the landing page is done. The associated website is done. I know I've been talking about that for months now, just working on a few bells and whistles to make sure that it's dynamite for you. So that'll be coming out here in the next couple of weeks. I guarantee that. And just excited about pushing forward and all the things that are to come. I have already booked my trip back to the Philippines. For 2023, I'll be there February, March of 2023. So again, we'll be starting up all of the promotion and excitement to get ready for my next trip to the Philippines. There's already people who have been asking me to come back, and leaders there in Asia who are excited about the opportunity to get me in front of their people and their prospects. So very excited about that. There's just so many things that are happening. So I'll keep you guys aware of all of the details in that regard. The email for the database to be added to the database is contactdrjeff@gmail.com. All right. Again, contactdrjeff@gmail.com. So a lot of you already have my email. We've already corresponded. If it's easier for you to just send me an email to my normal email for Lifewave related questions, that's fine too. If you see fit to send it to contactdrjeff@gmail, that's great also, because it just goes right into our Google worksheet, and it makes it easy for me to just copy and paste and put your email into the correspondence. All right. So guys, thanks so much. Praying for you guys. We had some crazy weather here in Dallas. It was the most precipitation in a 24-hour period since 1932. Had some crazy stuff. I woke up to some people being trapped in the creek next to my apartment. It was amazing. They had a rescue team drive a boat into the water and get them out of there. So wow, it's been an interesting couple of days, but God is good and everybody seemed to be okay and we're recovering. The rain has stopped. So excited about that and excited about all the things to come. We'll see you again next Tuesday, and make sure that you are fully updated on all the cool stuff that's getting ready to happen. All right. We'll see you guys next week.